Hi, folks. I'm Ray Walker with the Medicare Assistance Program at the Oklahoma Insurance Department, and you're about to listen to a recording of a webinar that we did previously on Medicare Advantage Plans. So we hope you find the information useful, and we also hope you have an opportunity to join us for our other webinars that are going to be coming up in the upcoming weeks. If you want more information about those webinars, you can go to our website at oid.ok.gov. Today, what we're looking at is the Medicare program. It's open enrollment time. And we were very frustrated. We were very concerned because now we're getting into that open enrollment period. And most of the time, me and my staff are out across the state doing different education events and talking to seniors and helping them understand what Medicare is and how it works and the different choices that they have with Medicare and helping them make decisions regarding their coverage for the coming year. And because of COVID-19, that's just simply not possible. So we're very grateful that people have assisted us to come up with this venue that we can utilize to get that information out to people across the state. And we're really hoping that people are going to take advantage of this. The seniors are the fastest growing group of utilizing social media and technology such as this. So we're hoping that it's going to catch on and we're going to be able to get that information out. It's a huge adjustment for us. This headset I'm wearing, I'm not sure whether I should ask you to supersize your meal or tell you what time we're landing. But I'm hoping that it's really going to help us to get to, so it sounds better to you guys, that you're able to hear what I'm saying, because I want to make sure that you've got all the information that you need before open enrollment starts, which most of you know, that's October 15th through December 7th. And those changes will be effective January 1st. It's a great opportunity for you to assess your healthcare coverage and make some decisions if you want to try something new or if you've heard about something that you think might be more effective to you. So today what we're going to focus on, and also before I forget, we are recording these events. We want people to be able to go back and listen to these events later on, or maybe you hear something that you want a friend to hear. And so those will be available on our website, and Adrian can tell you more about how to access those at the end of the presentation. But we just wanted to make you aware of the fact that these will be available at a later date if someone wasn't able to see them. So let's go ahead and get started. We're today going to focus on Medicare Advantage Plans. Medicare Advantage Plans have been around since quite a while now. I can remember working with Medicare Advantage Plans way back in the early 90s. And it's a managed care program that's been around, and they've grown. In the beginning, there were just a few people that were on the Medicare Advantage plans. Now, if you look at the total, there's like 59, 60 million people that are on Medicare today. And of those, a third of those now across the country are enrolled in a Medicare Advantage plan. So the popularity of these plans is growing, but I want to stress to you that that doesn't mean that they're going to be perfect for you. Everyone is unique. Everyone's needs are unique. Where you live impacts what decisions you should be making. So we're going to cover Medicare Advantage plans today, and hopefully I'm going to give you some information that's going to help you know whether or not this is a good choice for you, as well as for those people who may already be enrolled in a Medicare Advantage plan, if there's other options that you might want to talk to somebody about. On that vein, I do want to mention we do still have our counselors here at the Oklahoma Insurance Department, and they can be reached at 1-800-763-2828. We've got someone that answers that phone 24 hours a day, 7 days a week. So let's go ahead and get started talking about the Medicare Advantage plans and what's going to be taking place for the coming year. And again, please be patient with us. This is our inaugural voyage into using this technology, so hopefully we won't mess up too much. So what are Medicare Advantage plans? In the beginning, in 1965, when Medicare started, we just had Medicare Part A and Part B. And Part A covered you if you went into the hospital, and Part B covered you if you were seeing the doctor outpatient, or if you had some outpatient lab stuff done. And that was great, but that still left about 20% of the cost to come out of your pocket. And so at some point in time, the Medicare Advantage plans came along. Now, by that time, most people were familiar with managed care. That's those programs that are like HMOs and PPOs. A lot of us were on those plans when we were still working. Some of you may still be on one of those plans through your employer. And so that's how we kind of got started in this managed care realm. And then somebody created the Medicare Advantage plans, which we have today. What those plans do is they take the benefits that are available from Medicare Part A and Medicare Part B, and they combine them into a single plan. You're still on Medicare. You don't lose your Medicare, but now your Medicare services are being funneled through this Medicare Advantage plan. Also, most of those plans include your Part D prescription drug coverage. In fact, we always recommend if a person is interested in enrolling in a Medicare Advantage plan and they want to have prescription drug coverage, they need to make sure that they are enrolling in a Medicare Advantage plan that includes prescription drug coverage. You'll sometimes hear them use the term MAPD. That means that it's an MA plan, Medicare Advantage plan that has prescription drug coverage. Another thing that's unique about the Medicare Advantage plans is sometimes they throw in some extra benefits. Maybe for years now, they've offered things like vision and hearing and some dental coverage. Not all of them. Every plan is different in terms of the benefits they offer, but those were some of the things that were available to people. This year, we're seeing even more benefits that are being added. One of the other things that's been available for a while is like gym memberships and things like that. But now, beginning this year, we're going to see some more things that are being thrown in there that might also make those plans more enticing to you. So when you're in an MA plan, the things to keep in mind are, one, you don't lose any of your rights or protections. You still have the right to appeal any decisions that are made. You have just as many rights to question, request records. All of that stuff is still there, whether you're on traditional Medicare or a Medicare Advantage plan. You're still going to be able to get all the same services that are covered by Medicare Part A and Part B. All the MA plans are required to cover everything that are covered there, but a lot of times, sometimes those MA plans may cover some additional services. You can choose, you want to make sure, as I said before, if you want prescription drug coverage, you want to make sure you get a plan that includes that prescription drug coverage. There are a couple of options, Medicare Advantage options, that will allow you to have a separate prescription drug plan. But most of them, like the HMOs and the PPOs, you have to get your drug coverage with that plan. So when you're talking to a counselor, make sure that you mention that if you're interested in looking at the MA plans, you want to include one that has prescription drug coverage. Your out-of-pocket costs are going to be a little bit different than they are when you're on traditional Medicare. As I said in the first slide, Medicare covers approximately 80% of your costs once you've met your deductible. With the Medicare Advantage plans, what you're going to notice is instead of paying like 20% of the cost, you're going to have copays or maybe a co-insurance. It's going to be a set amount, like when you go to your primary care doctor, you may have like a $10 copay or $20 copay or something like that. So one of the advantages of the Medicare Advantage plans is it can reduce your out-of-pocket expenses for that particular year. Now, one thing that is important to know in terms of those costs is there are some services that CMS, the Centers for Medicare and Medicaid Services, they actually dictate that the MA plan cannot charge you more than what you would pay on original Medicare. Those are services, things like chemotherapy, dialysis, and skilled nursing facility care. So Medicare, the MA plans are offered by these private insurance companies, but they are closely monitored by the people at the Centers for Medicare and Medicaid Services. And as we said earlier, they throw in some extra benefits as well that might make that plan more appealing. Traditional Medicare does not cover routine eye vision checkups that you would get at the optometrist or dental care, hearing tests and hearing aids. Traditional Medicare does not cover those things, but one of these MA plans may give you some coverage. It may not be a lot of coverage, but it's better than nothing. Also with the Medicare Advantage plans, they have out-of-pocket limits. Traditional Medicare does not have that, but there are, if you look at the information available on these plans, one of the things that they're going to point out is that annual out-of-pocket max. That's the maximum amount of money that would come out of your pocket for that year. So whatever you're paying for your health care, in other words, the Medicare Advantage plan is paying the majority of the cost. But when your copays, co-insurance, when the cost that you're paying out of your pocket for that medical care reaches that out-of-pocket max for that particular plan, then your health care is covered at 100% for the rest of the year. Now, don't get your hopes up, folks. Those limits are pretty high. But we unfortunately have had people that have reached those out-of-pocket maxes, and it has helped to limit their exposure. So let's talk about the different types of Medicare Advantage plans out there. And I'm not going to spend a lot of time on the ones that we've had for a long, long time, because there's some new players out there that I want to make sure that you're aware of that might be available to you in your area. We'll talk about the HMOs and the PPOs that have been around for a long time. I want to mention some of the special needs plans that are available to Oklahomans here in our area, as well as we're going to talk about the private fee-for-service plans. And then we're going to really focus a little bit on these Medicare savings accounts
This is something new for people here in Oklahoma. Medicare savings accounts have actually been around for a long time, but they've not been an offering that was available to us here in Oklahoma. So I want to spend some time talking about those. With the health maintenance organizations, the HMOs, these are offered by, you've seen these companies that are out there, Humana, United Healthcare, Global Health here in Oklahoma, all offer these HMO products. Now, the HMOs tend to be the most cost-effective offerings available for Medicare Advantage plans, but they also tend to be the most strict. For one thing, they're going to have a network of doctors and specialists and hospitals and therapists, et cetera, that are contracted with that HMO. And as a member of that HMO, you are required to utilize their specialty network or their provider network. If you go outside of that provider network to get care, you could be responsible for 100% of those costs. So it's very important. One of the first things that I and our counselors will stress to you is make sure before you join a managed care type product like an HMO, make sure that the doctors that you want to continue seeing or the hospital you want to be able to continue going to includes those individuals. Talk to the doctor's office and say, do you accept this insurance? You can actually go to the website for that plan and ask, look on there and see if your provider is available. But I always recommend talk to the provider because their information is probably going to be more up to date. The other thing with the HMOs, if you want drug coverage, you've got to make sure that you get an HMO that offers drug coverage. So what's going to make that important is everybody takes different medications. And you want to make sure that the prescription drugs that you take are on the formulary. That's the list of drugs that are covered by that plan. You want to make sure that the prescriptions that you take are on the formulary for that Medicare Advantage plan. Okay. And again, that's something that our counselors can help you with when they're helping you decide on what's available. I got to adjust these headphones. All right. Do you have to choose a primary care doctor? Yeah, in most cases you do. And that's not necessarily a bad thing. This is the doctor that you're going to utilize most of the time to, help direct your care, help you, stay healthy and in those circumstances where you need to see a specialist, they're going to help you get to a network provider within the network for your HMO. A lot of times you do have to have a referral before you see that specialist. If you go to a specialist without getting that referral, then once again, you could be responsible for those costs. Another feature with the HMOs is sometimes they require a prior authorization before you get certain services. These are typically high cost items like an MRI, a CAT scan, maybe a surgery or something like that. So you would want to work with your primary care doctor or the specialist that's requesting the service to make sure that that prior authorization has been filed and approved before you actually deliver those services, or once again, you could find yourself being responsible for the costs associated with that care. The next one we're going to talk about is the preferred provider organizations, the PPOs. They're a lot like the HMOs in that they will have a contracted network of providers that you can go to get your medical care, and you can save a lot of money by going to those network providers. However, they also offer an out-of-network component that lets you go see another doctor if you choose to. It's just that the plan is going to typically pay significantly less for the care you get from that out-of-network provider. So let's say that you are in need of seeing a cardiologist. If you went to an in-network cardiologist, it could be that your copay for that visit would be $40 or $50. If you instead chose to go to an out-of-network cardiologist, then your plan structure would change and it might pay, say, 60% or 70% of the usual and customary costs. So you have the option of going out of network, but your costs go up by going out of network. So again, a really good rule of thumb is before you join that PPO, talk to the doctors that you know you're going to want to be able to see, that you know you're going to be going to probably more than once a year, and make sure that they're part of that PPO network so you're not having to pay the out-of-network costs. Do you have to choose a primary care doctor? No, not usually with a PPO, nor do you have to get a referral to see the specialist. That PPO plan can send you a list of what their contracted network is to know who those providers are that they do see and who's part of their network. Again, though, I always encourage people before you make the decision to join a PPO, talk to the doctor's office, whether that's your primary care doctor, cardiologist, pulmonologist, whoever it is that you see a lot, and ask them if they're part of that PPO network. They do usually include your prescription drug coverage. So again, if you want a PPO, make sure it's one that covers prescription drugs if you want that prescription drug coverage. Now let's talk about the special needs plans. These are relatively new. They are a managed care product that is available. And typically, if you're thinking about, if you want to compare them to one of the ones we've already talked about, they're most closely associated with the HMO, where there is a contracted network of providers that you're going to need to see if you want your insurance to cover it. But what's different about the special needs plans is, as the name implies, they are based on a specific need in the community. You could have a special needs plan that is based on where you live. It's called an institutional special needs plan or an ISNP. Typically these are, and we do have some of these in Oklahoma, this is a special needs plan that is available to people who reside in certain nursing homes or some other kind of residential setting. Oklahoma has some of those down in the Ardmore area and have had those for many years now. Another one is the DSNP or the dual SNP. What this is this is a special needs plan that is available to people who are on Medicare and Medicaid. They have a very set geographic area. So there is a DSNP that is available in the Oklahoma County area, and I'm pretty sure in the Tulsa County area, that is available. And but you have to be on Medicare and Medicaid, and you have to agree to see those network providers. There are also special needs plans that are based on your diagnosis. So there could be a special needs plan that was created for people who are diabetic or people who have a certain heart condition. It's based on what those specific healthcare needs are of the individual. The concept behind this is that most of those people who have that chronic diagnosis are going to need a lot of the same type services. And who better to direct that care than the specialists who work with that diagnosis? So I'm not aware of a lot of those type of programs that are available in Oklahoma right now, but that information, if it's available, will be coming out very, very soon. Generally, with a special needs plan, you will have a primary care doctor, but what you need to know is if it is, let's say that it's a condition that if it's a SNP that's based on your diagnosis, then your primary care physician may not be a general practitioner, so to speak. It may actually be a pulmonologist or a cardiologist or something like that. So again, the focus is on trying to manage the care of this specific population that has very specific needs. Okay, so here's a slide that if I had just waited for it, it would have showed you all about this stuff. So this kind of gives you a description of the institutional SNPs, the DSNPs, as well as the C-SNPs, which are the ones that are based on chronic conditions. They can actually, in some areas, there are some parts of the country where these C-SNPs are very, very common, and they can even drill down even deeper, so that it may not be just people who are under the care of a pulmonologist. It may be for a very specific pulmonary disease that plan is available. In most situations, if your provider, if you've got a specialist that is a part of one of these SNP programs, they may make you aware of that. If they feel like it's going to be a good fit for you, they'll bring it to your attention. So don't feel like you've got to go out and search for those. Oops, I think I may have gone too far. Okay, now private fee-for-service plans. These are also a Medicare Advantage product, but they're a little bit different than the others. The difference with a private fee-for-service plan, you know, the other two products that we talked about, they're very focused on the contracted network that is available through either the HMO or the PPO. With the private fee-for-service plans, you can actually go see any provider that you want to, provided that they are willing to accept your insurance. Now, with the private fee-for-service plans, a lot of them do have we'll call it a network of providers who have agreed to accept that private fee-for-service plan anytime you come to see them, whether you've seen them before or not. But you're not locked into that network. You actually have the option of going to any provider that you want to, But you want to make sure, and this is the responsibility of the beneficiary, you need to talk to that provider first and say, this is my insurance, will you agree to accept it? And it's important to know that a provider may accept that insurance on one visit, but that doesn't mean they have to accept it on future visits. So again, the beneficiary has to take responsibility for communicating with the provider each time they go in to say, will you accept my insurance this time? It's also important to note that the private fee-for-service plan will establish exactly how much of the costs are going to be the responsibility of the beneficiary. You don't need a primary care physician or a referral to see a specialist. The other thing that you want to make sure of is if you go to receive services using your private fee-for-service plan, let's say that you're having a procedure, an outpatient procedure done at a local hospital. You want to make sure that you are finding out from everyone who is involved in that procedure, will they accept your private fee-for-service plan? So let's say you go to the hospital where the outpatient procedure is being done, and you find out, will they accept your plan? Hopefully they will. Make sure that the doctor who's doing the procedure agrees to accept the plan. If there's anesthesia that's going to be involved, you want to make sure the anesthesiologist accepts your plan. We had a situation that arose where a particular hospital in one of the rural parts of our state utilized the services of a radiologist at a different hospital to read the results of the tests that they had taken, and that individual didn't know about it. So again, you just want to talk to the doctor, whoever it is that's providing the test, or the hospital where it's being done. Identify who all the providers are that you would need to talk to make sure that they're going to accept that insurance. Okay, now we're going to get into the Medicare savings accounts. These are, they're new to us here in Oklahoma. We didn't have these in the past, but they're here now. And many of you are going to be familiar with this because you may have had a similar insurance while you were still working. This is a product that combines a high deductible insurance plan with a medical savings account. And basically Medicare is going to deposit money into this account, and then you can utilize that money to pay for medical services, for healthcare services that you receive, some of which don't even have to be a Medicare type service. It can be a medical service that Medicare doesn't cover. And you, once that account is used up, though, you begin paying out-of-pocket costs until you meet that high cost deductible, at which point in time, your plan kicks back in and you don't have any cost sharing. Once you've met your deductible, the plan pays at 100%. It's going to cover all your Part A and Part B services, as well as some extra costs. Some things, one thing that's included in this, I don't know if it's with any of the Medicare savings programs, savings accounts that are available in Oklahoma for the coming year, but long-term care is one of the things that might be included on that particular MSA. Another thing that's different about the MSAs is, whereas your drug coverage was included with the coverage through an HMO or a PPO, and in some cases with a private fee-for-service plan, with the Medicare savings account, it is not. So you would have to join a separate Part D prescription drug plan if you wanted to have drug coverage. And if you want to learn more about the Part D prescription drug plans, we have a webinar that's coming up in a few weeks that will go over those. So how it works is, once you've decided to join a Medicare savings account, you talk to the plan, you go through their enrollment process. They will tell you, they will identify a local banking institution that they will ask you to open up an account in. Once you've opened up this account, your Medicare savings account company will deposit money into that account for your use to pay for medical services. Now, you as an individual cannot deposit more money into that account. This account is strictly to be used by that company that's offering the Medicare savings account program. They deposit the money in the account. You can utilize that money to pay for medical services. Again, it can be for services that are not covered by Medicare Part A and Part B. However, the only thing that will apply toward meeting your deductible, because again, this is a high deductible plan, the only costs that will apply to that meeting that deductible are for Part A and Part B covered services. So if you use that money to pay for something that's not covered by Medicare, that is not going to apply to meeting that high deductible. So that's very, very important for people to keep in mind as they're doing this. And then again, once you've met that deductible, then the plan kicks in at 100% for the remainder of the year. Also, it's noteworthy to point out that let's say it comes to the end of the year and you've had a great year. You didn't get very sick, so you had money left over. And so there's money left in that account. That money will stay in that account. So the following year, you actually have more money in that savings account to utilize towards your expenses. It just rolls over into the next year. So that's another nice feature about those Medicare savings accounts. So again, this is new to us here in Oklahoma as well. We're going to be learning more about this. And we're always glad when there's more options that are available to our seniors. So what do Medicare Advantage plans cost? It varies. There are plans that are available out there for a 0 monthly premium, and then there are others that are a lot more costly. It kind of depends on what that plan covers, where they're located, where you live, all of that kind of stuff. Now, you will have to pay your Part B monthly premium. One of the requirements for Medicare Advantage plans is that you do have to have Part A and Part B of Medicare. The Part B monthly premium this year is $144.60. I've heard rumors that it's going to go up in the nature of like $153 for 2021, but that official announcement has not been made yet. So that's just speculation. So again, you may have a monthly premium, you may not. There are a number of Medicare Advantage plans with prescription drug coverage that are available in Oklahoma for a 0 monthly premium. However, it's still very, very important that before you jump into one of those 0 premium plans, to make sure that they cover the providers that you want to see and they cover the drugs that you're currently taking. If you get into one of those 0 plans and it doesn't include one of your high cost prescriptions, there goes your savings out the window. So you want to make sure that you've got that taken care of as well. They may have a deductible, they may not. And the copays for those visits are going to vary depending. A lot of times for your primary care visit, it may be a lower copay than it is for a specialist. One of the things that's also going to make the cost of the plan vary is the type of plan it is. You know, an HMO tends to be less expensive because it's more restricted. You're locked into a network and that sort of thing. PPOs maybe cost a little bit more, but you've got a little bit more flexibility. So that's something else that you want to keep in mind. And again, if you talk to one of our counselors, they can go over those options with you. We're not going to make a decision for you. I'll warn you ahead of time, because we do get those calls from people who just say, just tell me which one I need to get in. Unfortunately, we can't do that. Our job is to provide unbiased counseling, and we can help you answer the questions, or to even ask the questions that you need to ask yourself to help you make the best decision for yourself about what care is going to be right for you for the coming year. And for some people, Medicare Advantage isn't the best choice. And if that's the case, so be it. But we just want folks to know what all of the options are that are available to you here in Oklahoma. Now, something that I want to point out to you is this year, one of the new things that's going to be available is there's going to be some extra health-related benefits that the Medicare Advantage plans are going to be allowed to offer. They don't have to offer them, and not every plan is going to be the same, nor does a plan have to offer all of those same benefits in every state. So you might see, or you might get a call from your sister or someone in another state that says, oh, my health plan is now covering this benefit. And so you think you can join that plan here in Oklahoma and get the same benefit. Not the case. A lot of times what we find is sometimes there are more benefits in states like California or Florida or someplace where there's a lot more competition amongst the Medicare Advantage plans. So hopefully we'll see some of these here in Oklahoma, but we don't know that for sure yet. Here's some of the extra benefits that might be available: adult daycare services, the memory fitness benefit, non-emergency transportation to things like doctor's appointments and x-rays and things like that, bathroom safety devices. So, and even some over-the-counter benefits, some benefit that would allow you to purchase items that are considered over-the-counter, not prescription, but that might enrich your healthcare. They stressed that they didn't call these supplemental benefits because they didn't want people getting these confused with supplemental insurance. But again, we won't know for sure exactly which benefits are going to be offered by which plans. There's also some special benefits that are going to be offered to people who have certain chronic illnesses. And the idea behind this is there are certain health conditions that if the health plan is allowed to assist with the cost of those, they will also help keep that individual healthier and keep them out of the hospital. So this could be a really useful benefit for someone who has a chronic condition. Again, we need to learn more about what those chronic plans are going to be, and if we're going to have any that are going to be available here in Oklahoma. Sometimes we tend to be the last people to get some of these benefits. But here you see a list of some of those benefits that might be offered to someone with a chronic condition. Home delivered meals, that's kind of self-supporting, and that can also include like groceries, produce. Of course, it's not going to cover things like tobacco and alcohol, but nutritious meals. Pest control, this is something that we don't often think about, but that for some individuals, that could be a lifesaver. When we talk about internal air quality equipment and services, that could be things like filters, dehumidifiers, humidifiers. Carpet cleaning is something that would fall under this as well. But if it's something that makes the environment more conducive to better health, then someone with one of these chronic conditions might be able to utilize some of these services. I think I just went forward twice again. So what are the rules? If you want to be eligible for Medicare Advantage Plan, you have to live in the United States. You do have to be enrolled in Medicare Part A and Part B. You cannot be incarcerated, self-explanatory. You do have to agree to provide the plan with all of your information, and that's going to include your name, your Medicare number, date of birth, address, all of that kind of stuff. You also have to agree to follow the plan's rules. That includes getting prior authorizations when required, using network providers when required, that sort of thing. And it's really important that you only join one plan at a time. We as Americans sometimes have a tendency to overinsure. The important thing for you to realize is if you get into a Medicare Advantage plan, there is absolutely no benefit to joining another Medicare Advantage plan at the same time, or getting into a Medicare supplement plan so that you've got a Medicare Advantage plan and a Medicare supplement plan. If you do that, then you're basically paying for a supplement that's never going to pay a dime for your health care. So don't do that. Here's something new that's going to be available this year, starting this year. In the past, people who had already been diagnosed end-stage renal disease, these are people who have kidney failure, they were not allowed to enroll in Medicare Advantage plans. It just was not possible for them. Beginning this year, a person who has end-stage renal disease now will have the option of getting into a Medicare Advantage plan. So this is a big change for this year, and I know that this is going to be very welcome to a lot of individuals that we speak with. To join a Medicare Advantage plan, you can do it yourself. You could go to medicare.gov, plan compare, and you can actually enroll yourself. I don't know that I would recommend it. I would certainly want you to talk to a professional about that before you actually pull the trigger on something like that if you're not really familiar with them. You can go to the plan's website. All of these health plans have their own website, and I'm positive by now you've received a lot of mail with that information on there. During this time period, we do tend to get inundated with more and more information about people telling you the plan that they think is the best. There are paper enrollment forms. As I said, you can do it online. You can also call 1-800-MEDICARE and actually do it over the phone. Now, this is a very, very busy call center, folks. So the chances of you actually getting everything done, it's going to take some time. But it can be done by calling 1-800-MEDICARE. I also want to stress to you, you can call one of our counselors at 1-800-763-2828, and they can also advise you. Now, we cannot enroll you in a Medicare Advantage plan. The laws in Oklahoma do not allow that, but we can help you get to the point to where you know which plan that you want, and then you can call an insurance agent here in the state. And we've got tons of really great insurance agents that would be happy to help you to get enrolled in the product of your choice. The other thing that I would also state on that, you have the ability to enroll with some of these plans over the phone. You could be talking to an agent over the telephone and do all this stuff. But be aware of the fact there is a certain benefit to working with a local insurance agent. You've got a face. You've got an individual here in your local community who has a vested interest in your healthcare. They want to keep you happy. That's how they make their living. That's how they feed their families. So sometimes there's some advantages to identifying who the local agents are who can help you with your insurance products that you're wanting to purchase rather than doing something over the phone, because then it's just often it's the faceless person over the telephone as opposed to someone that if you've got a problem, you can get in touch with them. So enough on that subject. Your first opportunity to get into a Medicare Advantage plan is going to be your initial enrollment period, which happens when you first become eligible for Medicare. If it's when you're turning 65, your initial enrollment period begins 3 months prior to the month in which you turn 65. If you're someone who's on Medicare due to disability, those individuals become eligible for disability in their 25th month. It's the 25th month that they've received a Social Security disability payment. They also have that 3 months prior to the month in which that 25th month occurs to get enrolled in a Medicare Advantage plan if they choose to get into a Medicare Advantage plan. They don't have to, they can stick with a traditional Medicare. Here's a diagram that kind of shows that time period. So if a person was becoming eligible for Medicare, let's say in the month of April, then they would have starting January 1st, February, and March to get enrolled for an April 1st effective date on their Medicare, as well as a Medicare Advantage plan if that's what they're wanting to pursue. Now, the other thing that I want to make you aware of is the next opportunity that they've got. Let's say that you've been on Medicare for a while and you're interested in looking at an MA plan. The open enrollment period that I mentioned earlier is October 15th through December 7th, and those changes will take effect on January 1st. Starting last year, the CMS, they came out with a new Medicare Advantage open enrollment period. This is a time period that is specific to those individuals who are enrolled in a Medicare Advantage plan. It starts January 1st and it goes through March 31st, as you can see on the slide here. The changes that you make, let's say that you're enrolled in an MA plan, but you want to switch to a different MA plan. Maybe you want to go to an MA plan that offers prescription drug coverage, or maybe you've got one that's got prescription drug coverage and you want to go to a different one that offers prescription drug coverage as well. You're not locked in. You can make multiple different changes during this time period. The only requirement is you have to be enrolled in an MA plan as of January 1st. If you make a change, if you make a request for a change in January 1st, or the month of January, that change will be effective in February. If you wait till February to make the request, it'll be effective March. So you can see how that kind of rolls over. So this is also a time period. Let's say you got into a Medicare Advantage plan and you decided you're not crazy about it. You'd like to get out of the Medicare Advantage plan and go back to traditional Medicare and maybe pick up a Part D drug plan. You can do that during this time period as well. It's also important to note that these new plans, the Medicare Savings Account plans that we were just talking about, they don't fall into this the Medicare Advantage open enrollment period. Once you enroll in a Medicare Savings Account plan, you're in that for the coming year because they've already started making deposits into that account that you've set up, et cetera. Switching to Medicare Advantage plans or disenrolling, you can do that by contacting Medicare. If you contact Medicare to do that, the act of them, or you can also contact a plan. If you're wanting to switch to a different plan, you can contact that plan that you want to move to. The process of them enrolling you in that MA plan will disenroll you from the previous MA plan. So if you're in MA Plan A and you want to enroll in MA Plan B, the process of enrolling in MA Plan B will automatically disenroll you from the previous MA plan. However, if your goal is to go from an MA plan back to traditional Medicare, you will have to contact the MA plan that you were enrolled in and request to be disenrolled. Now, they will probably ask you to write a letter, and it's very, very, very important that you follow those instructions and write a letter into the MA plan as quickly as possible. And I always encourage people to keep a copy of the letter you sent. I would also suggest sending it certified mail or some other way so that you've got a record of it. Now, for people, let's check our time, because I'm going to talk for about 3 more minutes and then we're going to go to questions and answers, because I'm really more interested in answering the questions that you folks have. Let's say that you're someone who is just starting on Medicare. You're just turning 65 and you think, well, I want to give a Medicare Advantage plan a try. You can do that. And then if within the first 12 months of that very first time of getting enrolled in a Medicare Advantage plan, you decide you don't like it, you actually have the option of disenrolling from the Medicare Advantage plan within that first 12 months, going back to traditional Medicare and enrolling in a Part D prescription drug plan. You also have a special enrollment period that you can look at getting a Medicare supplement plan. The same is true. Let's say that you are someone who's been on Medicare for a while, but up until now, you've had a Medicare supplement policy, also called a Medigap policy. But you've got a friend that they've got a Medicare Advantage plan. They really like it. They say they're saving money. So maybe you want to give it a try. If you've never been on a Medicare Advantage plan and you're currently on a Medicare Supplement plan, you can actually make the choice to disenroll from your Med Sup and try out the Medicare Advantage plan. If within the first 12 months of being on the Medicare Advantage plan, you decide you don't like it, you can disenroll from the Medicare Advantage plan and go back to your Medicare Supplement plan as long as it's still being sold. If for some reason that your plan is not still being sold, you've got other options to purchase another Medicare Supplement policy. Okay, the other thing that I want to point out, as I said, a lot of these plans have contracted networks, and you need to be aware of the fact that that network can change. Providers can leave that network, or in some cases, the plan can terminate their agreement with some of those providers. It's their responsibility to make sure that they've got an adequate network to continue meeting your healthcare needs. Now, that doesn't mean you get to keep seeing that same doctor that is terminated. If they terminate their contract, you may be in a position where you have to choose a different specialist because you don't necessarily have the option of quitting as well. You may have to stay with the plan that you enrolled in. Now, there are some cases, in very specific cases, that you can contact the Centers for Medicare and Medicaid Services at 1-800-MEDICARE and make your case as to why you need to stay with that specialist. Maybe you've got some chronic condition and this is the doctor that has treated you forever. And, so on a case-by-case basis, CMS may allow you to disenroll from that plan to go back to traditional Medicare. All right. So there are some other things that are out there, but I think rather than going through these, Adrienne, why don't we go ahead and let people ask some questions? I don't want us to run out of time. We're about 15 minutes to the hour.
Okay, so we've received a couple questions.
Great.
The first one I can actually answer, and it was about materials and whether or not we can download them. I will tell all of you that we're recording this, and we will send out a link to all attendees as soon as this video is available. I know Ray mentioned that, hopefully by tomorrow. So we will send out a link so you can watch this again, or you can watch it and share it with someone else. Second question is for Ray, and it's, does Medicare require approval for certain services?
Would you say that again, please?
Does Medicare require approval for certain services?
That's a good question, because starting this year, there are some procedures that Medicare will now require the doctor to get a prior authorization. These are some services that in some situations are considered cosmetic. I don't know the technical terms because I'm not a doctor, but like one of the procedures that falls into this category is that procedure to get that, that skin above your eye that sometimes can start sagging down and stuff. Well, in some situations, that's very dangerous. It impedes your vision. You're not able to drive safely and stuff. So in those situations, your doctor does have to approach Medicare to say, I need to do this for my patient, and it's for these medical reasons. And they know what they need to do. They know the documentation it needs to follow, because they're trying to make sure that they're not covering something that's being done for cosmetic surgery. Nose surgery. There's some sinus surgeries that are for a specific medical condition, but in some cases they're considered cosmetic. So that's the kind of the reason why they've set up that. But again, it's a very short list.
What is Medigap?
Medigap. You may have heard the term Medigap, also use the term Medicare Supplement Insurance. We've got a whole seminar that's going to be in a couple of weeks where Anna Farha from our team is going to cover that specific topic. So I would encourage you, let's see here, the Medicare Supplement is going to October 20th. So whoever asked that question, if you can come to that seminar, she's going to cover that in depth. But this is insurance, where the term Medigap came from is it covers the gaps that are left over after traditional Medicare pays. So this is a insurance policy offered by a private insurance company that works with your Medicare. So Medicare will pay as primary, and then your Medicare Supplement insurance will pay as secondary. And there are advantages to Medicare Supplement that we always try to go over when people are asking us what their options are. One of the options with Medicare Supplement insurance is you're not locked into a network. You can go to any doctor anywhere in the United States that accepts Medicare. So it gives you some flexibility. So that's one of the things that we go over with people when they're asking us what products are right for them.
Okay, we've got another one. Is there a way to look up drugs or doctors covered for a specific plan?
Okay, that is actually two different answers. Drugs, absolutely. That tool that I mentioned earlier, Plan Finder, that's available on the Medicare.gov website, and that's the same exact tool that my staff and I used. Uh, and if you're in the Tulsa market, Life Senior Services, they use the same tool as well. One of the things we're going to ask you is, what is the list of prescription drugs that you take? So before you call us, make sure you get your list of prescription drugs that you currently take, the dosage and how often you take them, because we're going to put all of that information into that system to identify and make sure that the plan that you're considering enrolling in covers all of your prescriptions. Now, as far as the provider network goes, you can go to the plan. Now, the tool that we're using doesn't show the provider network, but you can go to the plan's website and it will list their providers. But again, I encourage you, if there's certain doctors that you want to make sure are in that network, talk to the doctor's office. Because as I said in one of the earlier slides, that doctor may be thinking about not being contracted with that plan in the coming year. So always good to double check.
How can MA help with rural area members?
Okay, this is an important point that we always try to cover when we do our presentations. As I said, the Medicare Advantage plans have been around for a while, and they can be amazing in terms of providing coverage at a controlled cost. And if you live in an area that's got a lot of options, for instance, if you live here in the Oklahoma City metro area, there are a number of MA plans that are available, and they've got large networks. They see a lot of the different hospitals and stuff. But you'll notice as you get further away from the metro areas, the networks have a tendency to thin down. And so you want to make sure, again, before you enroll, who are the providers in your area? How far are you going to be expected to travel to see that urologist that's in network? Or, find out what's available. Talk to other people in your community that have information about that. Again, this is another area where having an insurance agent locally that's assisting you can be a huge benefit.
That's all the questions I have so far.
Okay, well, while we're waiting to see if anybody else wants to ask any more other questions, I do want to stress to you, we've got a whole slew of these seminars that are coming up, and I'm really glad that we've been able to get some of these speakers. We've got a couple of them that are going to be Gay Humphrey, who is actually with the Centers for Medicare and Medicaid Services. She's actually going to be doing our webinar next week on October 13th, same time. She's going to be talking about Medicare updates. There are some changes that are taking place. There's a couple of them that I mentioned today in my presentation, but she's going to be going in more in depth in what some changes are that you could be seeing for the coming year with Medicare. Gay is also going to be joining us on October 27th to talk about the Medicare Part D prescription drug plans. And we had a couple of questions that were related to drugs, and she's going to be covering those much more in depth on October 27th. Now, the week on October 20th, we're going to talk about Medicare supplement insurance, also called Medigap plans, and our own Anna Farha from my team is going to be covering that on that date. So if you're interested in Medicare supplement information, be sure that you join us then. On November 5th, we've got Jose Olivero. He's with the Social Security Administration, and he's going to be talking to us about Social Security, things you need to be aware of, anything new that might be going on. And Jose, if you've gone to any events here in Oklahoma, you've probably had the opportunity to talk to Jose. He's a really great speaker, and he knows a lot about this. Then on November 12th, I'm going to have the opportunity to sit down with Michael Fry. Michael is actually one of the deputy attorney generals here in Oklahoma. She's with the Oklahoma Attorney General's office. And what we're going to focus on in that conversation is we've got a lot of people out there that are trying to help their loved ones. Maybe it's your parents, or maybe you're trying to help another loved one that maybe has developed some cognitive issues or something like this. And that's awesome. God bless you for doing that. But we want to make sure that people are aware of where the line is. You can't, in your efforts to help someone, you want to make sure you're not taking away their rights, or that you don't accidentally cross a line that puts you into a legal situation. So I'm going to be talking with Michael about some of those things that people need to be aware of and where they can go to get their questions answered about things like that. I'm going to keep chattering, or Adrienne, do we have any more questions?
I think we're good.
Okay, great. Well, listen, I wanted to thank you guys so much for joining us. I hope you found the information useful. If for some reason I didn't answer your question and you've got other questions, you can contact our staff at 1-800-763-2828. You can also visit us via email. You can go, our email address is map, M-A-P, at oid.ok.gov. You can send us your questions and we would be happy to respond to those. Again, open enrollment is October 15th through December 7th. Folks, I can't tell you how important it is, even if all you're looking at is your prescription drug coverage, take the opportunity to go over the information with one of your counselors. In past years, we've been able to save people thousands of dollars by going through this process of reviewing what the prescription drug coverage is. A lot of times people don't understand, the formularies for these plans can change. The copay structure for these plans can change. This is a chance for you to see what's available in your area, what plans go to the pharmacies that you want to use. Has your doctors changed any of your medications? Maybe there's a plan that covers one of your new medications better than the plan you're currently on. We've been very successful in saving people thousands of dollars in the past. The other thing that I always stress is if you contact one of our counselors and you go through this process and lo and behold, there is a plan that would save you money, but you decide you don't want to change, that's fine with us. Folks, we don't get any money from any insurance companies. We don't take any money. We are a state agency. We're simply there to answer your questions and help you make the best decision for yourself. So again, thank you so much for joining us, and we hope you'll join us again next week for our presentation on Medicare updates. Thanks again.